Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Hafaday, welcome back to Healthy Living, and once again with us is Dr. Lom, and we are of course talking about pneumonia, and we're taking your questions now. And one of the questions one of our viewers had is, how can you differentiate between the common cold and pneumonia? And I know you talked a little bit about it earlier.
Yeah, and it's such an excellent question, because people come in often to the clinic and they're like, I'm coughing, I just want to make sure I don't have pneumonia. And so when you are, I think the key symptom that you would note if you had pneumonia would be shortness of breath. You may have chest pain, you may have cough, you may have wheezing, you might be coughing up phlegm with a cold or bronchitis or pneumonia. But with pneumonia, you're going to almost always have shortness of breath because your lungs, again, are affected, not the tubes. With a common cold, you're going to have upper respiratory symptoms, runny nose, sore throat, maybe some sinus pressure, maybe a little fever. But you're not going to have the same problem of the chest where you feel kind of a heaviness or a shortness of breath or just difficulty, strain in the breathing. Especially little children, they can't talk for themselves, little babies or young people under the age of 5, they can't explain their symptoms. So we look at the pattern of their breathing. How quickly are they breathing? Are they working hard to breathe? Because that's where pneumonia how it will manifest. But our gold standards is to get a chest x-ray. So you might end up with one of those.
Okay. Another question that we have is, what is pneumococcal vaccine?
There you go.
Did I say it right?
That was excellent. So we talked about the different kinds of organisms that cause pneumonia. We have, again, bacteria, virus, and fungal. And in the bacterial infections, again, I said strep pneumoniae. And another name for that is the pneumococcal bacteria, because that's just the shape of it. It's little round dots. That's the shape of the bacteria, and it causes pneumonia. So a sort of short form is pneumococcus. And there is a vaccine available. Now, it's typically given as like a prevention to anybody who's age 60 and above, one time to prevent pneumonia in the elderly, because that's a vulnerable population. But if you're a vulnerable person, for example, you're a smoker, you have COPD, you have bad asthma, you have cancer, you have diabetes, any of these other chronic diseases, you're a candidate. And most of the time your insurance will cover that vaccine for you, even if you're not 60. We give it to children that have, serious illnesses also. So it's covered under most insurance. If you don't have insurance, public health can give it to you when they have their screening. Self-pay, it's an expensive vaccine. It runs about $130 or so. But then again, if that prevents you from getting pneumonia, that's still a savings. Very effective vaccine.
Okay.
Yeah.
What about, I guess, other ways? Someone wants to know, is there any way to prevent pneumonia?
Well, the most important thing is to wash your hands. Don't smoke, okay? And stay away from people who are coughing. And if you are an employer, let's say, and there's people coughing in the office, ask them to go home or get checked, because that's how these illnesses spread from person to person.
Okay, this is actually a good question from one of our viewers. Is it more common in adults than children?
Well, I would say, both extremes. Really, the very young child, especially preemies, and the very elderly, these are the two extremes of vulnerability. I wouldn't know the statistics on whether, exact numbers or anything, but just as a rule of thumb, it would be the weaker ends of lifespan.
Okay, how long does it take to treat pneumonia?
Well, typically a person, like a walking pneumonia person, might get better after 10 days to 2 weeks on oral antibiotics. Somebody who's hospitalized might be in there for a week easily. We're getting oxygen as well, remembering that this is a problem that affects your ability to oxygenate your bloodstream. So typical recovery, typically somebody will be on antibiotics for about 2 weeks. Viral pneumonia, that's the hard one, because on the x-ray it looks the same as a bacterial sometimes. You can't tell. People end up getting antibiotics. They're not really doing anything for them. We're waiting for the virus to get cleared, and that one can easily take up to a month before they recover.
Okay. And a final question, what is multi-lobe pneumonia?
That's a great question. Okay, so our lungs are divided into pieces. Yes, on the left-hand side we have 2 lobes, upper and lower. On the right-hand side we have 3 lobes, upper, lower, and middle. And so you can get a segment, just a piece of that lung that's infected, or you can get more than one lobe or the entire lung. And of course, if the entire lung is infected, you're much sicker than if you just have a lobe. And guess which one is the one that's most commonly infected? It's the middle lobe, because it's the one that is kind of squished between the upper and the lower one. And so typically, if people have a segmental pneumonia, it'll be the middle lobe. So yeah, there you go. You find that out on an X-ray too. And when we listen, people often ask me, they come to the clinic, well, what do you hear? What are you listening for when you listen to my lungs? And of course, we hear a nice air entry in and out when we listen to the chest. We might hear wheezing. And when there's a pneumonia, we'll hear crackles. And crackles sound like a little pop, sort of like a very light sound, a little popping sound, because it's when the sponge, thinking of the sponge that's closed, now it's wet in there because there's pneumonia, it'll open and it'll make a little popping sound. So we call those crackles. And when we hear crackles, we are very worried about pneumonia.
Well, thank you so much. Any final comments?
This is the flu season. Please get your flu shot, because flu can also result in pneumonia, and we want to keep you safe and healthy.
Okay, always a pleasure to have you in studio.
Thank you so much.
If you have any topics that you would like for us to cover, any questions for the doctor,